And okay, so we have all the panelists here. Thanks again. I'm the moderator. I was not supposed to be the moderator. I've organized the sessions that are here in this room for the whole day. And so I like to be more on the background. Also, I work for WHO since 2002, and I'm responsible for health impact assessment studies. And it's a great pleasure and honor to have gathered these panelists for this session that is on land use, and is following a discussion that we have had on transport and agriculture. There will be another session on waste after this, just to give an idea, I would say, of what is the state of art of the discussion on these sectors that provide a big source of air pollution. So I just want to say take another minute before introducing the panelists, saying that this session is on land use and green spaces because we thought that it's quite important to think about different features that are related to air pollution. That is not only just emissions or the measurements of different pollutants that are in the air or the health effects that they have. It is also important, literally thinking about how we use our territory. So where people are living, where people are moving to go to work, people that are commuting. So here, all these panelists will take, I would say, a much more much more freedom than the other panelists that were just focusing on one sector. And I think this is important. That's why we also put green space, because there's a lot of discussions about the use of green spaces, for example, to reduce exposure to air pollution. And I don't want to take much more the floor, except for saying that this panel, again, is organized in a kind of democratic way. We do not have keynote speeches. They're all keynote speakers. And this means that they have a responsibility to not to talk so long, more than 8-9 minutes is okay. And we have also a video to introduce this discussion. And our panelists come from very, very different background. And again, this is, I would say, the richness of the discussion that we want to promote here. I have to thank the technicians again and the people that are translating. I ask everyone to speak slowly, and so this will facilitate the work of the translator. Obviously, also for the audience, it's good to not to speed up with our jargon, acronyms, and way of talking fast. And so I ask the technician to go with the video. We have a first video by Steve Him, that is an expert. He's a professor at in Singapore at the university. And he has been working a lot on the use of land use data and health data. So we start from, I would say, a super scientific academic approach, but then we will move toward, I would say, different perspectives. So I leave the floor to Steve that could not travel to be with us, but I think it's important to have 3 minutes for me. Thank you.
Hi, everyone. My name is Steve Yin. I'm the director of the Center for Climate Change and Environmental Health from the Nanyang Technological University, Singapore. Thank you very much for WHO inviting me to give a talk to share our research related to air pollution, land use, and health. So many medical studies report the serious association between air pollution and different health outcomes. So one of our studies also found out the strong association between the black carbon exposure and the lung adenocarcinoma, particularly for female. And that highlights the serious problem of the air pollution on the human health. So there are a lot of the places over the world experiencing the urbanization. One of the good example is the Pearl River Delta region in China, which is the southern part of China with 11 cities within a small like region areas. And then this region experienced a rapid urban expansion from 1990 to 2010, as you can see in the figures, the brown color representing the urban areas. So from 1990 to 2010, that increased a lot of the land coverage to becoming urban areas. So our studies would like to understand how this kind of urbanization activities would affect to the ozone pollution and the corresponding health outcome. So as you can see in the figures here, urbanization can increase ozone quite substantially, can be up to 7 ppb in a year. And then that can translate to around 40% increase in the ozone-induced premature mortality. And that is the ozone concentration level. And then ozone formation is highly nonlinear. As you can see in this figure, x-axis is the precursor emission, and the y-axis is the ozone concentration level. And then the brown curve here showing the relationship between the precursor emissions and the ozone, and the curve is not a straight line. Transitional studies always focus on particular emission scenarios and the corresponding ozone concentration level. However, when we look at to the slope here, that basically change with the different precursor emissions. And that gives us the very important research question is how the ozone would change given to different precursor emissions and different emission regimes. And then our studies have found out that the ozone sensitivities to precursor emission change quite substantially given to the rapid urban expansion cases. And particularly that we look at to the urban greening like mitigation measures for urban climate issues. Because the greening vegetations would is a one type of the emission sources for the volatile organic compound VOC. If we do not have a careful consideration of the VOC emissions, so if we apply this kind of urban climate mitigation measures to the urban areas, we may worsen the ozone pollutions in the cities. So that is a very important finding to highlight the importance of the co-benefit strategies to mitigate urban climate issue and also the urban air pollution issues. And at the same time, in our in these studies, we also introduce a very important concept of precision environmental management. Precision environmental management means that if we think about the mitigation measures to fix, for example, the urban climate issues or urban air pollution issues, we cannot simply apply a generic like strategies to a city, because different cities would have different characteristics with different background, climate, air quality, or the air compositions. So at the end, one same mitigation measures applied to different cities with different background or characteristics could have a very different effect. And that is why we need the very careful like the strategies to mitigate the problems in a city. And our research also found out the increasing trend of the global hot and polluted episodes, HPE, and the PM2.5 exposure during HPE can cause 700,000 premature mortalities in the past 3 decades. 80% happen in global south, and that is the problem that we are going to face in the future. And our studies also find the trend of the global HPE here in terms of frequency, duration, and also the intensities. They are all increasing. And that is the very important findings telling us that in the future, we will experience more frequent, longer duration, and more intense HPE in different parts of the world. And that is the also the very important like the research to develop advanced models to produce high resolution maps for supporting the urban planning to mitigate urban climate and pollution issues in order to protect the population health. Here are some of the examples of what we developed the local air pollution modeling with the machine learning technologies to produce the high resolution maps for different cities. And one particular example is the one that we apply the machine learning and land use regression model technologies to Seoul to looking at the high resolution air pollution map and do the source apportionment to understand contributions from different sources to the air pollution in Seoul and the corresponding health outcome. If you have interest, you can check out the publications in the bottom of this slide here. And then we also have one ongoing project funded by the National Environment Agency Singapore to understand and even project the urban heat island effect and the public health risk in Singapore. As you can see that we will apply the construct the heat vulnerability indexes for Singapore to highlight the hotspot of the heat stress locations in Singapore and the corresponding public health risk in the country. And take-home messages here is, first of all, we would like to highlight the strong interactions between land use, urban climate, and air pollution. And particularly, we highlight the need of the co-beneficial strategies. And also, we need the advanced models to provide the high-resolution maps for supporting urban planning, particularly for urban climate and urban air pollution issues. And as we find that we are going to face more the hot and polluted episodes in the futures. And at the end, I would like to acknowledge different funding agencies to support our research. And I'm looking forward to more like the discussions in the session here. And if you have any questions about my work, feel free to contact me. Thank you very much.
Okay, so we start with our panelists. The idea was to start literally from the most the largest kind of areas and this global approach. So we have Anthony. Each panelist, you can introduce yourself. So, oh no, first we have David. Okay, sorry. But then we will have Anthony. Okay, David, behave yourself. You have too many slides. Never too many. No.
Can I have? Well, I'm gonna stay here. Yeah. Hello, everyone. So I'm David Rojas, Colorado State University, and thank you for inviting me to be part of this session. So what I will be sharing is a little bit a picture of green spaces and human health, not through the single pathway of air pollution. It's just the living in proximity to vegetation and what actually that means for human health. So to see the potential of green spaces and vegetation. So there's many opportunities here, and for those that were staying came before to the transportation session, you saw these slides. And I like to showcase that because there are many interventions or policy interventions that will affect multiple pathways for the public health perspective. Of course, air pollution is the most important now that we are talking, but it's not the only one. The same policies that try to tackle air pollution will help us in many other ways. So in the urban context, we have all these different opportunities or policies that design cities, density, destinations, transport, and all these affect how we behave, how much time we spend inside or outdoors, and which kind of mode of transport we use. And that will affect our exposure to air pollution, but also to noise, to green space, to neighbors, so social cohesion, and that will impact health, morbidity and mortality, and death, premature mortality. So what you see here is the connection between how we design and the policies that are part of the urban planning and how it finally affect how we behave and our risk factors. Of course, this conference is centered in air pollution, and this is where green spaces is located in all this big picture. So what is the health evidence? What the epidemiologist says about green spaces and human health? So vegetation is connected, and I don't expect that you read each of these circles, but what I want to highlight is that many pathways. It's not a single pathway that tell us that green spaces and vegetation will modify human health. We are learning a lot, and we are continually doing studies to really learn what is the magnitude of each of these pathways. But we know now for a lot of cohort studies that this relationship exists. And the relationship can happens because green spaces can affect biodiversity, environmental microbiome, and I apologize for the slides that they're bad shape now. And the environmental microbiome affect the human microbiome. So the microorganisms that we have at the skin and the mucus that modulates the immunological response, and that will affect how the immune system works. And this is not only important for infection diseases, the inflammatory process. All the chronic diseases are related to chronic inflammation process, and that will implies affecting health. So the presence just of proximity to vegetation will modify that pathway. So here we have a great benefit for multiple non-communicable diseases. The absence of green spaces will modify heat, that was mentioned before, and that will especially bad for those that already have respiratory cardiovascular diseases, and that will increase dehydration, and that will increase heat stroke, and that will end with death. So then the absence of green spaces, we have here another risk factor. As again, just want to highlight the pathways that we are learning about. Multiple organs and systems have been associated to green spaces. It's not only one single organ or system, there are multiple outcomes that we are talking about this. So how green urban policies can impact human health then? So this is the grid of streets in Barcelona in Spain. What you see here is almost no trees, no vegetation, a lot of concrete. It's a perfect city to walk. It's a perfect city to arrive to the destinations because you live in close proximity to the destinations, to the stores and workplaces. But the Barcelona had a lot of air pollution, have a lot of traffic. So the mayor wanted to remove many of the land dedicated, the public space dedicated for traffic to walking, cycling, and green spaces. And they wanted to remove those black lines, those streets, to more public space. And this is the before and after. This is then the top is the same street, the same intersection with the cars parking and moving. And in the bottom is the change. So what you see here is that they create a new plaza in an intersection, and they have more trees and vegetation, and people can walk, cycle, and enjoy, have a terrace and have a drink and meet the neighbors. So what we did in this case, we analyzed, well, what is the impact if they implement that policy across the city? And one of the main purpose of that policy was to reduce air pollution. And here you have NO2. The concentration, the darker areas are the areas with high concentration of NO2, and this is the after. If they implement the super blocks across the whole city, you will see just the distinction of intensity of the color. So that is a reduction of NO2. What happens in terms of green spaces? That is the before and this is the after. They will increase green spaces. The same policy will increase green spaces. And it's not that policy is not only in terms of air pollution, green spaces, but also noise, heat. So there are many co-benefits of those policies. And this is the effect that we estimated each year more than almost 300 premature deaths will be prevented, postponed if Barcelona achieves to implement the whole city superblock system. And in terms of green spaces, they will be contributing 60 deaths. But as I mentioned before, it's not a single pathway. There are multiple pathways here. So there is a great opportunity here to improve public health. We have done similar work in Philadelphia. This is the US. What in this case, the city of Philadelphia wanted to increase tree canopy. And the question was, well, where to put those new trees and how to implement that policy across the city. So what you see here, the map is the city of Philadelphia with the circles highlighting two different neighborhoods with low and high levels of tree canopy. And we modeled that for the future, that is 2025 now. So, and the policy scenario in this case was, what if we can increase 5% of tree canopy across the city? What will actually mean? And we quantified that increased trees in the city of Philadelphia will reduce, postpone, or avoid more than 260 premature deaths each year and that was equivalent to 2% of the deaths that occur each year in that city just for planting trees. And that equivalent of 2.4 billion would be US dollars of economic impacts. We did an analysis between those neighborhoods they have more challenges in terms of the socioeconomic indicators, and we found that those that in the lower scale of the socioeconomic indicators were the ones that will be benefit the most with that kind of policy across the city. We have done similar work in different locations, Phoenix and Denver, and this is because they're in different climates, and they want to also increase tree canopy. And we did a model. This is Denver, and what you can see here is the health benefits of implementing tree canopy across the city in Denver, achieving 20% of the land for tree canopy. And this is Phoenix, 25% of the land on tree canopy, and the amount of health that it can gain. So great opportunities again. What do you imagine when we talk with stakeholders about green spaces? What do you think is that? It's a park. That is a fantastic thing. But this is Denver in Colorado. We don't have many of those trees that you see here are native, are important, and the exotic plants. We don't have this kind of trees. What some public urban planners think in terms of vegetation is that bringing this kind of trees, and we don't deserve to have this kind of trees in any place in any city in the planet. So we need to be careful. We don't want to be at the problem to say just bring more vegetation based on exotic plants that have an impact in the ecosystem, in the maintenance, in the impact on water use. So what we are working now is identify, well, what if you implement interventions on vegetation with native plants? Is that beneficial for human health? And this is Denver again with a map on the different census tracts and the different intensity of vegetation. And we model different policy scenarios. What if you use native plants in the stormwater retention areas? The easy place to start. And this is the amount of deaths that they can prevent if they implement that native plant policy. Repairing areas across the city. And this is the benefit. What if parking lots, and we have a lot of parking lots in Denver, what if 30% of the parking lots or the land at the surface in the parking lots are shifted to native plants? That will be the benefit. And what if they implement a policy across the whole city? And that will be the benefit. So you see native plants, and we want to be part of the solution and no unintended consequences bring more problems to the cities. One question we get often is that for green spaces, you need a space in the cities, and a space already packed where you can put more space. So green spaces are fighting against density. One of the recommendations in public health perspective is we need more densities. Is that possible? Yes, it is. So many cities across the planet, they are combining vegetation and density in the same place. They're not against each other. This is Singapore and this is Barcelona. You can find many places to put green spaces, and these type of green spaces will be providing health benefits. So this is an analysis we did globally. What we are trying to identify is that all the networks of the streets in the city where people are located, try to identify the quantity of vegetation that are around their people, and we have that data globally. This is the NDVI map globally. So the NDVI means an index of vegetation that we can take from satellites. And we did an analysis in almost 16,000 cities to see what is the impact of vegetation and density in those cities. And the comparison here is that there are neighborhoods with a lot of density, one with a very poor or limited levels of green spaces, and others with a lot of green spaces with the same density. What if those with limited green spaces shift to that reality? And we did that, and just an example here, the map of Chicago with vegetation, density, and we combined vegetation and density to really measure the exposure and then quantify per year if the cities just increase the vegetation, take into account the density they already have, to a comparison point in their own cities, we can save more than 700,000 people deaths per year. So this is what we can gain just investing more in green spaces. just a list of different cities and countries that we have finding the benefits. So with WHO, we are working on translating that evidence. This is one of the reports that we are working. They have preparing a lot of information and tools for giving this translation. One of the tools is GreenUR as a GIS-based tool. So what you have here, the tool use maps. And this is the map of Guadalajara in Mexico. We identify where the vegetation is located, the public spaces dedicated to vegetation, who lives in proximity to those green spaces, and what is the benefit for the presence of those green spaces. So more than 500 premature deaths that can be prevented, postponed, or avoided each year, only to maintain the green spaces they already have. So great opportunities. Just the finalized topic is that in terms of green spaces and human health, it's important to talk that proximity is essential. It's not only the presence. People is benefiting because they are living in proximity to green spaces. It's not important. It's not enough to have a huge park and people living kilometers from that place. They need to live in proximity. We need to think that interventions should be based in native plants, local biodiversity, local context, climate considerations. So there are many other co-benefits and adaptation and mitigation of climate change, and also the equity lens. We need to start where the needs are existing the most. And thank you. I will stop here. And sorry if I went too fast.
Okay, now I made a mistake in the sequence of slides. It should not have been the second. Anthony was the second. So Anthony, the floor is yours. Just please introduce yourself quickly, and then you go on with the slides. They're already there. Okay.
Well, thanks. So, no, I guess this is what happened when you send your slides in the morning of the session. So, no problem. So good afternoon, everyone. So I'm Anthony from the European Space Agency, and this morning someone called me the satellite guy. So I don't know if that's maybe a better nickname for the event this week. So I wanted to complement the talk of the other speakers and give you some insights about Earth observation. And a bit demystify a bit this technology, and showing you some example of what we've been developing throughout some projects at the European Space Agency. So let me start with this picture, and which is the slide that we show at the very beginning of most of the presentation to showcase the number of missions. And don't get too excited. They are not all about air quality monitoring, but just to show that there is a lot of data, a lot of things that are provided by the different European institutions. All data of the satellites and missions that you see here is free and available to everyone. So what do we do with this data is basically we monitor the Earth system throughout all the aspects that we can. So it can be land, oceans, atmosphere, of course, and as well the atmosphere and the pollutants. So just maybe I wanted to spend also some time on the tropomy instruments, which is, let's say, the right horse related to atmospheric composition. So you see the satellite on the bottom left, and what it can measure is basically the total column of different trace cases. One of them being the nitrogen dioxide, but we also have the total column of ozone. So not only the tropospheric ozone, unfortunately, but also formaldehyde, methane, carbon monoxide, and other trace gases. There was a video showing how tropomy works, basically, and so it does like 16 times 16 orbits per day, meaning that in theory you have one point of data over everywhere in the globe per day. But in theory, meaning that of course there are limitations, being like you need sunlight for this instrument, and as well when you have clouds, it's a limitation. So what do we do with this tropomy data, right? And here I want to showcase some examples of things. So start you see at the bottom left, right? You see so it's the city of Madrid, And you can see on the bottom left, let's say the tropomy measurements, like a typical tropomy measurement. So it's like a dozen of pixels throughout the cities. And what you see in the main screen is like a detailed model, right? So it's a dispersion model that we fed with some satellite data, but also local data, in order to have this high quality model relevant to the human, like to health, right? And so, yeah, I think it should animate it. Okay. All right. So yeah, it's just to show that what we've been doing with this air quality model and service, that you can visualize, let's say the air pollution of here it's NO2 from different times, and compare it so you can see the evolution and see how, like, from year to year, from month to month, how it evolves. And as well, if you zoom into some areas and like, or the most polluted, or let's say also the green space in the city, then we are able to do some time series related to that. So it's, I think, a powerful tool to communicate on, let's say, implementing policies and showing how the air pollution decreased or increased in your city, hopefully decreased. So I wanted, this slide is showcasing a bit how the project that we've been funding partnered with, let's say, and was uptaken by a company, a Spanish company, Lobelia, and they worked with the municipalities in Catalonia to really, like, go one step further in advertising this data, and providing some, I don't know, they show the model at TV. They also provide a tool for healthy routes. So, like, basically, if you want to commute to your daily work, how much am I exposed, and all of these kind of things. All right. So the session today is about air quality and health, but on green spaces. And here I wanted to show you this animation of a project that we've been doing, not about air quality, but about basically mapping in over a city. So here, a bonus point to the first one to know which city is that. No, Vienna in Austria. I know there's someone from Austria in the room, right? Okay. So basically, with remote sensing technology, you can map at quite high resolution. So here it will be commercial like satellites. It's not available, free available data for this resolution. But basically, you will be able to map where the green roofs are, and as well map where potential green roofs with sustainable, that could host, let's say, green roofs in your city. So it's really in the context of, we did that in the context of the Green Transformation Information Factory project with Austria, to really gather all together tools based on remote sensing technologies to provide some information and actionable information on the green transition in Austria, of course. Another product in this green transition information factory is land surface temperature. So it's not the temperature of the land at the surface, it's of the air at the surface. It's really land surface temperature. But still, here I think it's quite striking. Like, so the full picture of Vienna, and then I just selected, let's say, where you have the habitation, basically the buildings and everything, and then the green part. And you see the color is quite striking and different. So basically, green space provides, shelter for, like, heat waves and everything. All right. So it was just few examples. We've been also trying to, let's say, map all the services that we do for cities, and organize also as well webinars on the city. So I invite you to either watch these webinars that are available on the website, and as well to let's say to to check the services, and also if you have some feedback, we are really eager to take some. Last advertising for an event that we'll organize probably in September in Paris about Earth observation for health in general. Thank you very much.
Thanks, Anthony. And okay, now we go a little bit more feet on the ground. We have been flying very high with the first presentation. But Melissa, now it's your turn. Yes. So take the floor. And let's see. Let's see if it's your turn.
No, it's not mine. No. Ah,
Yes. So
my turn.
introduce yourself.
Yes. Thank you so much. Good afternoon, everybody. I will deliver my presentation in Spanish, so I will give time to change your devices. Bueno, mi nombre es Melissa Córdoba. Yo soy
My name is Melissa Cordova. I'm Deputy Director for Healthy Cities in Latin America. Today I'm going to talk a little bit about the planning and how this moves to be a public policy for green spaces. Maybe you have this clear. The planning, the urban and territorial planning is key in the environment. It influences in outcomes for public health and well-being, and most of all, outcomes in health. The engagement of health in planning is essential to guarantee not only health, but also equity in all territory. What is the link between urban planning and health? Here I want to put everything in context that there are some tools that help for this to be given. Sometimes we are only used to measure the impact of our policies after, but it turns out that this is an ongoing work in which it is important to assess these impacts all the time, from the beginning, from the planning of the policy. For example, the use of tools such as RQ Plus, the impact analysis for health that allow to have a baseline to determine if those policies work or not during the implementation, or other type of analysis such as economic studies, epidemiological studies that can allow for these policies can be assessed, tested, even to be changed during the implementation process. This is basically what I was saying before. Measuring these impacts, the importance of continuing these assessments, and most of all, methodological tools that will help to improve these methodologies and impact methodologies. Well, here I want to share with you the work that from the cities, Healthy Cities Partnerships we have been doing. In this partnership for healthy cities, this is a network of 74 cities around the world in which we promote and advocate public policies that will help reduce non-communicable diseases and lesions. Here I bring you these cities that have been working in this surveillance of air quality. So here we have Dhaka, Fortaleza, Toronto, Bogota, Jakarta. For example, in Dhaka, they have been working a lot in low-cost sensors to monitor the air quality. And also, having data, improved data to support public policies. Fortaleza, which has an interactive dashboard to analyze some risk factors for non-communicable diseases and therefore enhancing the decision making. Last week, we had our summit, our year summit for healthy cities, and Fortaleza was one of the cities that was rewarded and recognized and acknowledged as excellent in this type of work that it has been doing. I will share with you more about this, how this city has transformed in terms of policies. Toronto, more than using low-cost sensors or dashboards, they have implemented surveys to determine the behaviors regarding air quality and heat. Bogota, we've been working during this previous 2 years in enhancing and improving the app of the index, the Bogota Index for Air Quality, to be more accessible for the population. And at the same time, some strategies, education strategies and communication strategies for people in city will empower all those decisions that are being taken with respect to the air quality. Also, in Bogota, we've been doing an impact health analysis. Here we have Samuel together with the WHO, with Pierre. We did an important workshop on November last year, and from this workshop, we already have a good outcome. We have an analysis of the health impact not only from Bogota City, but also from their different municipalities. So we are still reviewing the document, but what we can see about the initial outcomes is this inequity in the air quality that we have in Bogota. Maybe those who were in the session where Julian talked about that changing the street, the life hope would change. It also happens with air quality in Bogota City. So also we were able to analyze mobility. Bogota has very good data. So this has taken us to reprogram some types of strategies about sentinel surveillance of mortality that will provide and consider what's going on with diseases, with this type of diseases and how they are related to alert periods in the city. Jakarta, we have been spoken about Jakarta in this conference a lot. They are using this process for communicating air quality and also some quality data to be used for decision making. These are the other cities whom we also work. Tokyo, they are using a mobile app to inform residents about air pollution. Kathmandu is strengthening its sensors system to improve air quality data collection and dissemination. Bucharest is expanding their network, sensors network, in order to improve forecasts in terms of air pollution. Kigali is evaluating policies such as the car-free areas. This type of policies can create an impact, positively speaking, to the cities. Kampala is also designing a strategy to approach and address the air pollution using scientific evidence. So with all of this, what we are doing in this program is that the cities are going to strengthen their systems, are going to strengthen their analysis capacities so they can provide that decision making. I want to talk a little bit about this has been translated in policies for green spaces. Last week, I was talking with the city of Fortaleza, with its vice deputy mayor and the technicians, trying to dig a little bit more what they have done with data and to bring this information for you. This information is almost new, is recent. So they shared with me that one of the things is that they have focused in districts where they have started the process of green spaces and vegetation. In this place, in Pirambu, they have also improved this shift and towards native species for sustainability, because it's not only to make the space greener, but also to have diversity in those interventions. And also improving vegetation to help these issues about climate change. And Bogota, of course, with Bogota was also present in this event last week of our Major Carlos Galan, together with the Secretary of Environment and the Secretary of Health. And they are going to continue with the process of tree planting around the city. In 2019, the city planted more than 53,000 trees. But their goal is to get to a total of more than 800,000 trees. Also, to have corridors, to have green corridors around the cycling lanes. As you saw, if you were in Julian's session, he showed a map of how these cycling ways are organized in Bogota, the cycling lanes, together with the botanic garden. These green corridors will be integrated in these green processes, spaces. And of course, that there's a goal in the air plan for 2030. All of this is accompanied through the process. And for this year, we want to support Bogota implementing this tool, the Green UR, because they want to do based on evidence. They want to do this based on evidence. So I think that all of these spaces have filled my mind with ideas for Bogota to continue with all the work based on evidence. And finally, I want to bring these conclusions for you. Data is required for decision making, but data are only reporting. People are the ones that take decisions. Engaging health, engaging the rest of the sectors allow a better comprehension of data, a better comprehension of the situation to generate public policies that will be more integrated and more comprehensive, than it can reduce inequities in territories. We also have talked and discussed before about the active transport. We are also in our partnership. We advocate for the active mobility, sustainable transport. This helps us to minimize non-communicable diseases and lesions. And of course, we cannot leave behind the health communication campaigns and the engagement of the community. Without the community, it will not be possible for a policy to be sustainable. We cannot do policies from a desk. We require the co-creation of the community in all these processes. And well, this is work that is centered in planning which is essential to reduce the burden of these diseases and to enhance resilience and to create healthier and sustainable cities. Thank you so much. Sorry for my voice. Air conditioner has me with a sore throat.
Melissa. We have two more panelists, so we are going literally feet on the ground more and more with Barranquilla in Mexico. So Margarita and Sergio. Margarita, now it's your turn, and Sergio, Sirat will be our last panelist, and then we will have questions and answers. Let's see if you come out. Yes. Oh, fantastic.
Well, good afternoon. I'm going to speak in Spanish, so you can put your head. Bueno, el día de hoy.
First of all, I want to thank the invitation for participating in the conference and to show what has been done from Barranquilla in terms of the urban green space management. Barranquilla is a city very close from Cartagena. We are 2 hours drive. We are known by Carnaval, by Shakira, the singer, and probably we are getting to the North Colombia. Now, as a successful case, we have worked together with PAHO precisely on the implementation of the different tools that David has shown we saw on the first day of the conference. Probably you have heard about which. But before showing the results of Green UR that I want to show today, I want to talk about what is it that we have done in the city in terms of planning that as of today, it's helping us to improve the quality of our life and to strengthen that urban management within the city. At this moment, our development plan has a name. It calls Barranquilla at another level. And if we go backwards, Barranquilla began a process since 2012 with one of those first programs that was called All of Us to the Park. The city before didn't have spaces or parks. If with the first image that we see on the upper right-hand side, there were places that didn't have any vegetation. We didn't have a community, of the population wouldn't go to the parks, just afraid of getting some sort of disease. That has changed, and an investment has been done since 2012 to 2023. More than 1,750,000 square meters in the urban area had been improved in parks as well as urban areas for the enjoyment of the city. That translates in that more than 320 parks have been recovered. They have been implemented and developed, and also with a focus towards health of the population. Today we can see people in Barranquilla, the elderly women that meet at 5 in the morning, 7 p.m. to exercise, to do physical activity, to be able to enjoy these urban areas. And we have about 91% of homes are within a 10-minute walk from a park in Barranquilla. And that is something very interesting. And in terms of urban environmental management, within that, in the city, we have implemented a project that has to do with planting trees. I'm representing the environmental authority here. And beside the authority, that we have some compensation matters, we also have a project that is called Plant More. We have planted between 2023 until today more than 133,000 trees. I would like to tell you about this ecosystem that we have. We have a dry tropical forest. Those when we plant a tree, they should be higher than 1 meter to have a better capacity to survive to the climate conditions. And that has been focused on Barranquilla to be a greenhouse that more than 35 hectares are destined for those trees. And this has been a whole process of learning. Before we had different species of area, then we migrated to having our own silviculture manual, considering the endogenous species, and we have gone through the planting of trees, also intervention at this moment with all sorts of gardens. From the authority, we have promoted biodiverse gardens, precisely thinking on pollination. And it was very interesting some time ago when we began to do compensation planting that we began to see, because we don't only wanted to stay in the public space, but we wanted to go beyond and take those private zones, the backyards on those big houses in vulnerable areas. So we began to work on urban, uh, we have shared areas, and inside the houses we have areas where we begin to see hummingbirds that go from one tree to another, and to be able to have in the future that connectivity, ecosystemic connectivity that is required. There is a goal, and a goal on a short term 2027 is to be able to have more than 743 square meters on urban green areas intervened within the city. Now, one scenario that probably you have heard about and that has been successful is the Malecón del Rio, or the boardwalk, as Dr. Guillermo called it, the, uh, the Life Avenue, which is called Considering the Health and How People Are Going to Do Exercise in the City. And Malecón, or the boardwalk, has received more than 34 million visitors. Those who have come to Cartagena or to this zone in the coast, we know that Cartagena, Santa Marta have been acknowledged historically for being more attractive to tourism. Barranquilla is more commercial. So these interventions are making Barranquilla to be a city that to be a very attractive city to be able to be visited. We have spaces where the community goes, where we can have children, more than 56,000 children, young people being directed or being brought to Malecon, to these green areas. There is a program that was created, which is called I Am Active. The mayor's office has a trainer that go every 2 days to the, they do exercise without charging, promoting health and the uses of the spaces trained by the mayor. We want more people to go outside, and that it makes a challenge for us to work on the quality of air and the exposure by people. There are some other projects being worked on this year, such as public transportation transition, how the reinforcement of the quality of air, working on the air quality management for the city. Another example that I wanted to bring is precisely the Mallorquín swamp. This is an ecosystem in Barranquilla where all the community would turn their backs to. You can ask 2 years ago to the Barranquilla community, they didn't know or they didn't understand that there was an ecosystem, such an important ecosystem. Now it has brought a recovery process on that we, since the environmental area, we were able to plant more than 62,000 mangroves in the, and in a process worked with the community. And today we have more than 450,000 visitors. Something that we have been working on, it has to do with the importance of the urban planning and trees and green areas is on mental health. At least in the city, it was designed a space where people who have any problem could communicate, and precisely in those spaces in the synagogue for free yoga exercises are taking place, working with the population precisely to be able to work on improving mental health and to have better indicators in the city. So as I was telling you at the beginning, and you have heard a great deal from us, we implemented for the city through the city AirQ Plus. When it was implemented, we took some data and we did comparison on the quality of air 2018 against 2022. There was a reduction achieved. More than 500 deaths could have been reduced if we covered the indexes of the WHO. Active transportation had an implementation as also Green UR, which is the tool that help us to estimate the impact of those green areas on health. If we see the results, what we have is people who live close to the green areas, NDVI, which was calculated here, and I have to give the credit to the PAHO, David, who has been on that implementation of the tool, prevented deaths yearly. What we see with this tool, we have been able to prevent more than 20 deaths associated to air pollution, and we have economic value related to this prevention. Understanding that at least more than 2.3% of the city could have a destination on green areas, which is very interesting if we go 12 years back where we didn't have parks, parks were only sand, areas that were totally abandoned. So this is a very important figure, which is interesting to highlight how we can continue working, but also understanding what has happened. We know that we have challenges, and those challenges are now we want to develop this tool, and we can say how we can do an analysis per sector, how we can work on sector. And during the whole conference, we have talked a great deal about inequality that exists associated to the atmosphere contamination, on the development of plans, on the use of green areas. So how can we begin focusing on sectorizing those analyses? How could we handle or have updated the information and the use of the tool, at least with a period? We are in 2025, 23, 24, to be able to model scenarios with deforestation. Without it, Barranquilla is a very urbanized city, and the challenge that we're facing is a very big one. The challenge that we have in environmental education with the community is very strong, working with trees, because we have that dry forest that loses the leaves, and people might get bothered by those leaves. So there are challenges. Obviously, strengthening the policies using the tools and the results that they have yielded. And obviously, I wanted to highlight our strategic partners in all this process. PAHO, Clean Air Fund, and Barranquilla was acknowledged, and we have within vital strategies also as one of those cities, and what we have done in these cities years in terms of quality of air. We not only, because of the scenario, I presented the tool, and PAHO helped us to be able to develop the first air quality management plan for the city, and that has helped to the strengthening that we have today, the management of the quality of air. This brought us for the network that we had at the beginning. We have more stations, so we have been able to go beyond at the level of the decision makers to be able to ground the policies on the climate change plan that we have for the city. We were able to develop a strategic line associated to environmental health, understanding the importance of being able to work and improve the green spaces and the urban environmental management for better health and better lives for the citizens. And that is what I wanted to show you as a case. Thank you very much.
Gracias, Margarita.
Sergio?
Gracias a usted.
Hola, muy buenas tardes. Vamos a iniciar.
Good morning. Good afternoon. I want to show you a case study how the Chapultepec forest from city of Mexico is affecting air quality by the PM 2.5, which is the most important air quality issues from Mexico City. First of all, some context. Chapultepec forest has more than 18 hectares. It receives every year 24 million of visitors and offers spaces For sport activities, it's frequent seeing people jogging, walking, cycling. It has cultural spaces, specific spaces for older people, for children, for family, for tourists. This is the lung of our city. The study was based on a comparison of air quality that are registered in the monitoring system of the city. We have 34 monitoring stations, not only in the city of Mexico, but distributed around the state in other city that surrounds city of Mexico. So it's specific to have clarity. PM 2.5 emissions are local or are due to transport. We have this information, and we also have a forecast system which was used. This forecasting system includes information of the emission inventory, disaggregated in time and space, includes in meteorological and weather information, dispersion information, and photochemical to have access to information of a forecasting of a secondary pollutants such as some secondary particles, plus ozone. Having this information, these spots were determined. CH are the ones that are inside the Chapultepec forest. Those that have OT are outside. And also, in the map, you can have some monitoring. We did an analysis of the dominant wind. 5 years were analyzed of data in the monitoring stations. It's important, the monitoring stations, because this allowed us to have information about speed, wind speed, direction speed superficially. And from this information, it was determined what stations could allow us to identify the stations that had a correlation with the Chapultepec forest. And from here, in this analysis, we did this type of graphs. This is for 2019. With black spots, we have the concentrations of PM 2.5 in the upper part, concentrations of 24 hours generated with the monitoring systems. Red spots, we have the modulated, and we for the 2.5 we had to use a correction. The filter of Kalman filter was used, and you can see in blue color how with this correction we had an extraordinary correlation with what was observed and modulated. In the lower part we have ozone, the maximum value in 1 hour for 1 day. The modulation was done for a year, emphasizing in the March and April ozone season, highest temperature, less clouds, less wind speed, and this is when it promotes a bigger generation of ozone, but accumulation. From this work, we have this type of analysis where we can observe. Here we can observe, we have this station of air quality monitoring system, because the direction of the wind, you can see this. Here we can have clarity about how it impacts on concentrations. Here we are seeing what's modulated, although we have some closed station, which is an air quality station, and we can observe how there's a reduction in the concentrations of PM 2.5, reductions that are variable. They vary. The lowest value, 3.5% less of PM 2.5 due to the effect of Chapultepec forest, but we have had reductions close to 22%. This allows us to realize the relevance of this lung of our city. We also need to say that the benefit is not only seen within the Chapultepec forest, but also in the lower wind. And it is important to mention that we still need to complement this study with internal measurements inside the Chapultepec forest with low-cost sensors, because it's likely that inside measuring Chapultepec forest we can have even lower concentrations. Why is this so important? We have a contingency environment plan, which when we have a certain high concentration, it is recommended to citizens to avoid doing outdoors exercise. However, this recommendation is done, is highly likely that in Chapultepec forest, those conditions for pollution are going to be radically different. The climate will be different, a microclimate, and it is feasible that those passionate for sports could continue performing outdoor exercise independently, that the conditions surrounding the forest of Chapultepec could be indicating that there's a low air quality. For the ozone case here, we see more red because we have a different scale. But we can observe how we have a concentration that's really high in this monitoring station, and how in the lower part it's going to improve. When we are in Chapultepec, the best one comes from 4.8, depending on the point that measurement was done, up to 22%, the same as in PM 2.5. And what's important here is that after in the low wind in Chapultepec, or besides Chapultepec, we still have high ozone. This occurs because ozone, differently to the PM 2.5, is a more regional pollutant. In such a way, the impact in ozone is practically when it's inside the forest, not around them. The opposite to the PM 2.5, so somehow they are staying, they are getting sedimented in the leaves of the trees. But ozone, the impact is seen whenever we are in this point. From this type of studies, it has been decided in Mexico City to have policies that advocate the enhancement and expansion of parks and gardens. But David was mentioning something interesting. It's not useful to have a big lawn. We need to democratize these green spaces in such a way that the City of Mexico launched a program for many years now that is called pocket gardens, or pocket parks. They are small spaces that come from 100, 400 square meters, where it's easier to find these small areas, take them in the municipalities, and then developing green spaces that can be used by this society in case of reading for elder people, for recreational purposes in children. There have been successful experiences, some under bridges that were places where people go and threw garbage were taken by these people, not the violent people. And when they put these pocket parks, it started creating another microenvironment, socially and environmentally speaking. This type of spaces not only condition a better air quality, but also condition a microclimate. They can also support us to attack that heat waves. And of course, those of us who have been in a park, in a garden, we all know that this is like a buffer, a noise buffer. City of Mexico is extremely noisy city, and when we are in these spaces, not in the pocket, but in the bigger ones, yes, there's a buffer impact on noise. And to conclude, currently we are doing assessments with the Atmosphere Science Institute in order to identify what could be the effect of the alveoli of having green backyards, because something interesting and important, but also it's really in rooftops. And technically it's not so easy to develop to moisture, weight, but this research is being done, and depending on outcomes, we could take some actions to foster and promote this type of measures. Thank you so much for your attention.
¿Preguntas? ¿La audiencia tiene pregunta? Ya le llevaremos su micrófono. Sí.
Thank you very much, Isabella Nisi Maisano in CERM, but also the European Academy of Allergology, Clinical Immunology. So, as you can imagine, for us, some trees, plants, etc., are not good because of the allergic impact. So I imagine that you know that very well. Here we are talking about vegetation as a whole, but it's needed to think about which kind of vegetation. Also, the dose effect is very important. If you, in a very strange way, in Lyon, in France, they put only birch tree in one park. A birch is very allergenic. You can imagine the planted people around that before were healthy people start developing pollen allergy. And I also want to say that we know now that pollen pollution made a bad cocktail. So pollen become more allergenic when there is a pollution. So I just want that you give me your point of view on that, because this is an important issue. Thank you.
Thank you for the question, and I will open to anyone to respond. But these are great points. So, in my presentation, what I showcase is the benefits. Nothing is just purely good. Are there risks associated with green spaces? One is the aerobiologic effect. So pollen is one of those risks. Pesticides, all the chemicals that we use to maintain degradation of the soil, the water, injuries, crime. So there are many bad things about green spaces in urban settings. The good thing is that most of the epidemiological evidence take into account many of those considerations when they track populations from a healthy years of life to until they happen to have any health outcomes. So overall, our sense is that even the risks, there are still benefits. But when we talk about policy interventions, we need to suggest which kind of plants we should suggest to be implemented. So when we work with landscape architects, we are learning a lot of which kind of plants they should be there. So, and we have that discussions often that some landscape architects support specific species of plants because they are more resilient to droughts, they grow faster, and they're easy to maintain. Sometimes those plants are the worst for pollen. So we need to also think about what kind of plants will be the best recommended in terms of allergies that, as you mentioned, have an interaction with air pollution, and that will increase the severity of the morbidity associated with air pollution and allergenic effects. The other thing is that the sex of the plant also matters. So it's not only the type of plant, but also the sex of the plant that matters in terms of the pollen. So this certainly should be part of the conversation. So the specificity of the intervention should take into account the type of plant, the location, the sex, to really support mitigating or reducing the negative externalities of green spaces. Thank you for the question.
More questions?
Perdón, en el caso de la Ciudad de México.
In the case of Mexico City, we have worked in the process of reforestation, taking care for trees that are planted are the ones to generate the least units. They will have a problem of ozone, and these terpenes are highly reactant and they produce a great deal of ozone.
Too much air conditioning in this conference. My name is Giovanni Viegi, National Research Council in Italy, and I represent also the Italian Societies of Pulmonology, Allergology, and is the International Society of Doctors for the Environment. Recently, we have endorsed in our documents the so-called Rule 330-300, which is three trees visible from each house, 30% of canopy in every block, and 300 meters of distance maximum from your house and the park. I haven't heard this rule here, and I would like to have your opinion.
I can say something. I have seen that, and this is a great target and suggestion. And even have seen that there are some studies that try to quantify what is the benefit to implement that kind of policy. Certainly, it's a great policy, and we need to identify all the ways to support policy interventions, monitoring and evaluation of targets like that. I think more vegetation is needed in cities. This could be one way to attract the attention to implement vegetation. Not sure if we should support 3 trees in every place, because now talking about Phoenix, there are no native trees in Phoenix desert. So probably we need 3 type of cactus from home. But yeah, the idea of vegetation should be there, and good. But the idea of vegetation and proximity is very important. Thank you for that comment. Local native plants. That's right.
Hello. Oh, it's not me? Okay. Thank you for your talks. My name is Marina from Polytechnic of Lisbon. And following the first question, another issue that we also have to consider is the size of the trees where we are putting them, because they could decrease the dispersion of the pollutants on the cities, which means that for one side seems that we are improving the quality of air on some streets, but then when we realize the pollutants cannot be dispersion through the atmosphere. So this is one topic. The other one is the fact that, I don't know if you already heard about this, but there are some new technologies called like bioreactors that are using algae in order to absorb the CO2, and this could be also a good options to be implemented in the really crowded cities, since don't need like sun or nothing like that, only air that pass through the algae and are absorb the CO2. Thank you.
Bueno, buenas tardes. Primero, muchas gracias.
Okay, thank you very much for that information. It is good to do oversight. The local governments, especially in Latin America, they are cycle of 4 years and nothing ensures the sustainability of these sort of projects. What ensures length of time is the community participation and the participation of communities as overseers of these spaces. In this sort of initiatives, do you develop some sort of co-creation, as you were saying, with the community, so the community takes ownership and generates somehow sustainability towards the future? Thank you.
Uno, sí hemos escuchado en Barranquilla sobre estas torres de microalgas, estos reactores.
I don't know if you have heard in Barranquilla those microalgae reactors. They are generating reactors with microalgae. We are verifying. I am a fan of microalgae. I'm a biologist and I have worked with them. We have known and we're calculating what could that removal be of carbon associated, especially for cities such as ours that we are urbanized, that we don't have the spaces for planting trees. We have many trees that are very old that are generating, in some cases, we have to work for the problem of the infrastructure. So there are many problems with the community in terms of the tree that is destroying the pavement and the roots are not were not properly planted. So there is an intervention that needs to be worked on in terms of allergies. In Barranquilla, we have been working with allergenist making this doctor has been doing the analysis, but at some moment we will be able to do it for the city. And effectively, in terms of citizenry as an overseer, in terms of Barranquilla, we have environmental education plan that with which we are the mayors of it developed. We get only everybody secretary goes to different neighborhoods and communities to hear firsthand what the community needs, at least. So they come and say, what happens is that I need more trees, we want trees, we want to do changes, and that is the main theme of each secretary. They bring the offer from the this is a mechanism of citizens' participation. And there are some other mechanisms. We have Youth for Environment. We want to get something called, at least, the citizens seed bed, working with children and young adults in the different topics associated to air pollution, climate change, and that would be one of the points that could help us to understand how improve the dynamics of communication with the community, because the community is there, they have the problem, and we have to be there to listen to them. That is how we have been working on.
I'm president of the International Federation of Medical Students Associations, and sadly one of the few youth voices in these conferences. In most of medical schools, we don't learn about how green spaces impact health, but we clearly know after all this amazing lecture that urban planning and city designs are key health determinants. So based on your experience, how can ministries of health work more closely with urban planners to ensure that green spaces are treated as health priorities?
Hola. Yo creo que, como lo comentaba, salud.
I believe health has to be included in all these planning processes, urban planning processes. Definitely, we have been talking about health in 20 years in policies, and there are some in countries, even some cities, still there are challenges for other sectors to integrate health in their policies. I believe we have to continue working working on this to have that prioritization. But I believe that currently we know more, why there are better tools to analyze, to prioritize, to determine what those impacts are in health that those policies have. I precisely remembered that this morning I read that in Bradford, a city in the United Kingdom, the publication was saying there is no association between the green spaces and the improvement on health, mental health. We know that there is evidence. So we began to see what the methodology of the study had been. They say there is no, that's what the methodology didn't give this. So probably this is people who do not live here, but it happens that it was a cohort that we followed for at least 5 years, in which there was no association between the green spaces and mental health. I continued reading to see what else I would find, because finally there is evidence, strong evidence against this. So in the end, the researchers, what they determined was that the zone, the green space, has problems. People experience stress. This result is more expensive on mental health. What do you think? Wouldn't have been easier for the title to say there are problems on safety, or instead of saying that is an association between mental health? With this, I mean that finally Here is in which we can analyze from different perspectives this sort of policy and that they integrate the urban planning from all this to reduce this sort of analysis that end up being very superficial and that do not reflect what we have been working on for years with the green spaces. And there are people who could take advantage of this sort of publications and to say that this not work, but they like better another sort of development in infrastructure with more cement, to call it somehow.
I hope that it was an interesting discussion, and I know that there is the esplanadas outside. There is this air pollution pods, and people are visiting them. We will have a sessions in 20 minutes, so if you want to have some fresh air, that's the place to go now. But thanks, our panelists again for their patience and for all the interesting topics that they brought to us. Thanks also you for attending this session.